AIDS prevention pill study halted. No benefits seen. Associated Press. Researchers are stopping a study that tests a daily pill to prevent infection with the AIDS virus in thousands of African women because partial results show no sign the drug is doing any good. Women taking Truvada, made by Gilead Sciences, Inc., are just as likely to get HIV as other women who've been given dummy pills, an interim analysis of the study found. Even if the study were to continue, it would not be able to determine whether the pills help prevent infection since the results are even this far along, researchers said. The finding is disappointing because another study last fall concluded that Truvada did help infections in gay and bisexual men when given with condoms, counseling, and other prevention services. Many AIDS experts view that as a breakthrough that might help slow the epidemic. The epidemic is an epidemic of behavior. There's no other way to look at it. The pill wasn't preventing the spread of AIDS. The condoms were. I know whenever you mention the word abstinence that you sound like an old fuddy-duddy because, people are just going to do it. They're just going to do it. Well, what on earth would be the motivation for any pharmaceutical company in the United States to really get behind the R&D required to cure AIDS? Why? So the government can either take their patents, as Bill Clinton said the government should do, or tax them to the point where it's actually a cost loss to cure AIDS. Oh, but Andrew, somebody should cure AIDS because, lots of people have it and it's a pandemic. That's not why AIDS is going to get cured. AIDS is going to get cured if there's unadulterated profit in curing it. Now, here we go again. You have to ask yourself, who do you think, if we're going to have a rush to cure AIDS, who do you think is likely to cross the finish line first? Somebody or some entity driven by profit, or somebody or some entity driven by a feeling of community or sense of morality or empathy for those suffering with AIDS? The truth is that profit will cure AIDS. If there is unadulterated profit in the cure of AIDS, then pharmaceutical companies will compete tirelessly to get that brass ring. But if the looming threat is government revocation of patents or theft of intellectual property or taxes so far beyond what a company is willing to pay, then there'll be no cure for AIDS. I can tell you this right now, and it's funny that we're talking about this during the release of Atlas Shrugged. Because if somebody had asked me, Andrew, listen, we need a little advice here. We've decided that we're going to make a movie based on Atlas Shrugged, but it's not going to be Atlas Shrugged. Well, then John Galt would not be an engineer who was able to create electricity out of thin air or static electricity to power to create electricity, static electricity, whatever, to engineer a motor that would run on static electricity pulled from the air. John Galt would be a researcher on the verge of curing AIDS before he left society. Hank Reardon wouldn't be a metallurgist. He would be a computer software programmer. Dagny Taggart wouldn't be running a railway. She would probably be running an airline. But that's besides the point. If I were the John Galt of pharmaceuticals, me, Andrew Wilkow, and I was on the verge of curing AIDS, and the president sent somebody from the Department of Health and Human Services to sort of look over my shoulder and to sort of inform me in one way or the other that either I'm going to price the drug for affordability or the government is going to take my patent or tax me to the point of diminishing results, I would say to the president, I would say to Bono, I would say to anyone running an AIDS charity, there will be no cure for AIDS if you get in my way. If you in any way, shape, or form get in my way, try to impede my profits, I will not bring this to market. You can call me a monster. You can call me whatever you want, but the cure for AIDS will not come to market if you try to get in my way. If you threaten me with tax increases, if you threaten me with a revocation of patents, I will stop working. Now, the question would be, who's the monster at that point? Me, who has the power to cure AIDS and is only asking that I own my intellectual property, or government and or activists who are willing to hold it hostage because they want to control it. You decide. The truth is, AIDS is a pandemic of behavior. It is, and it always will be. AIDS is not spread because of a lack of federal funding. AIDS is spread through behavior. AIDS most notably made its way to the United States through transmission between gay men. That is fact. But you're not allowed to say that in the public square. If you link in any way, shape, or form gay men to the spread of AIDS, you will be shouted down, you will be perhaps physically assaulted, and you'll be disqualified from any public venue on this discussion if you link AIDS to gay men. But the funny thing is, if you say anything about AIDS, the first people in your face about it are gay men. They'll tell you up and down that it's not a gay disease, but the first people in your face, if you have anything to say about AIDS, are gay men and gay activists. 1-866-95-PATRIOT. Here are some of the other headlines. Let's see. Some support for pancreatic cancer screening. Why seeing overweight people makes us eat more, not less. Is sexually transmitted gonorrhea becoming a superbug? Numbers show prescription drug abuse a growing problem. These all from Yahoo News under the health section. The other problem we're facing with the creeping federal takeover of the healthcare system, and it is creeping, and I have some audio of Obama speaking at Facebook and his choice to head the bureaucracies of Medicare and Medicaid, Dr. Donald Berwick, speaking to the NHS in England. The creeping problem is that the healthcare system will be politicized, meaning that if on one side, if you have finite resources for healthcare, and on one side you have people who are sick due to their own behavior, cigarette smoking, overeating, or STDs. On the other side, you have people who have diseases that they are suffering with by no action of their own. In other words, children with birth defects, certain forms of cancer unrelated to cigarette smoking, so forth and so forth. You can't treat everything to its fullest extent. There literally is not enough resources. We're already in deficit. So what's going to happen is, like everything else, we're going to throw more money into the pot, and then we're going to see which politicized representative is going to come out ahead. Is it going to be the AIDS people, the pancreatic cancer people? Is it going to be the juvenile leukemia people? It's kind of like throwing a piece of bread into a koi pond and seeing which fish breaks off the biggest chunk. Instead of saying there's no reason why government should be paying to offset the behaviors of people. If you eat yourself into morbid obesity, that is your fault. If you smoke yourself into lung cancer, that is your fault. If you drink yourself into alcoholism and are no longer worthy of employment, that's your fault. If you are sexually promiscuous and you get yourself an STD that is terminal, that is your fault. You can't look at a child born with an illness that may kill him or her before they even turn 5 and say, we're going to treat you exactly the same as a 40-year-old man who has spent the past 20 years having unprotected anal sex with hundreds of other men. We're going to treat you the same as somebody who eats themselves to literal morbid obesity and can't even get up. And I'm talking about these 400 and 500 pound people who have to be carried out in a crane and buried in a piano case. I'm not talking about somebody who's a little flabby, somebody who's a muffin top, somebody with a little extra junk in the trunk. I'm talking about Jabba the Hutt. I'm talking about these people who look like a human version of Jabba the Hutt. And no matter what you tell them, they just continue to shovel it in their faces. Well, that's why we need Michelle Obama to pass laws. No! Again, you can neither tell people how much they can eat, and you can't treat them when they make themselves fat. It's getting the government out. For better or for worse, a component of liberty is that for better or for worse. In a liberty-based environment, some people are going to eat themselves to death. And you know what? That's their decision. Is it the wise decision? No. Does the government know best? No. Even if we do know that that's not the wise idea and it's going to kill that person, who the hell are we to stop them? If their pursuit of happiness is eating, if they die in their pursuit of happiness, so be it. So be it. That's life. If somebody takes some pleasure in smoking cigarettes and they get lung cancer and die, that is their fault. So be it. I am not cruel. I am not inhumane. If you know that cigarette smoking is bad, don't smoke cigarettes. It's not the government's job to tell you you can't do it. If you know that overeating is bad, don't do it. If you know that sexual promiscuity is bad, don't do it. But the funny thing is, of all the behaviors I just listed, the only one we're not allowed to talk about is sexual promiscuity. Again, you have the right to do as you wish with other consenting adults. I don't care if you're straight, gay, bisexual, a swinger, a wife swapper. If that is the choice you wish to make in life, your freedom to be you includes my freedom to be free from you. If I can't stop you from your lifestyle, I'll be damned if you will take my wealth to save your own life. That's the funny thing about the pursuit of happiness. If person A pursues happiness by achieving wealth and the other person achieves some lifestyle, and their lifestyle has a negative result, how dare you seek to rob from somebody else's happiness, which is their wealth? Who the hell do you think you are? I owe you nothing. If I say to you, hey, you think it's a good idea to go out, take drugs, and put your manhood where another man evacuates his bowels and you don't even really know him? You think that's a good idea? You go ahead and do that anyway. I'm not going to stop you. It's none of my damn business. You've told me it's none of my damn business. Keep your laws off my body. Keep your government out of my bedroom. Fine. Just make sure we keep the government out of your bedroom when you're sick as well. Now, I want you to listen to this, because here's where we're heading. Now, the politicizing of the healthcare system is going to... Who is the most prominent political activist for children born with diseases? I don't see any ribbons. You barely even see those purple ribbons for pancreatic cancer. Everybody's on the AIDS bandwagon. We got to solve that problem. And the problem is always, we haven't given enough money to gay prom nights in San Francisco. Oh yeah, they're there. The San Francisco Chronicle said they're there. I have a whole folder on it. Paz proms, as they're called. Gay bowling nights. Cruises around the city. Seminars on how to continue having anal sex when your partner is suffering with irritable bowel syndrome. Give me cut 2.
What we did in the Affordable Care Act, building on what we did with the Recovery Act, is try to provide incentives to providers getting integrated, automated systems. And it's tough because the individual doctor may say to him or herself, I don't want to put the initial capital outlay that's expensive, even though it may make my system more efficient later on. So providing some incentives, some help for the front-end investments for a community hospital or for individual providers so that we can slowly get this system more effective, that's priority number one. We know it can be done, by the way. Surprisingly enough, the healthcare system that does the best job on this of anybody is actually the Veterans Administration, the VA healthcare system, because it's a fully integrated system. Everybody is working for the VA, all the doctors, all the hospitals, all the providers. So they've been able to achieve huge cost savings just because everybody's on a single system.
Single system. Everybody working for the single system. Where have we heard that? Oh, Andrew, you guys are crazy. The president doesn't want single payer. The president's not going to try to impose Canadian or European health care on. Really? I could see one of the guys at Facebook. Sounds to me like he kind of wants some kind of medical Skynet, like from the Terminator. No. He wants a medical Death Star, like in Star Wars. No. He wants to be able to say computer, like in Star Trek. 1-866-95-PATRIOT. He continues. This is pretty ominous. Play cut 3.
We know that hospitals can drastically reduce those reinfection rates just by simple protocols of, how employees are washing their hands and how they're moving from room to room and so forth. There are hospitals who've done it. If we can say to a hospital, you'll get a bonus for that. Medicare will reimburse you for instituting these simple procedures. That saves the whole system money. And that's what we've tried to do in the Affordable Care Act, is to start institutionalizing these new systems. But it takes time because we've got a private sector system. It's not like the VA. It's a bunch of individual doctors, individual hospitals, spread out all across the country with private insurers. So it's not something that we can do overnight. Our hope is that over the next 5 years, we're able to see significant savings through these mechanisms.
So basically, all these individual doctors and individual hospitals spread all over the country doing their own thing, we can't have that. We've got to have everybody on one single path. Because if there's only one path, nobody gets lost. Wait till you hear what Obama's pick for Medicare and Medicaid had to say in England to the NHS. We're right, they're wrong, that's the end of the story. The arguments cannot be broken. You're a homophobe. Sirius XM Patriot. If the choice is in our society, on one hand, people be more responsible for their behavior, or on the other hand, the rest of us are always paying a tax for the negative result of behavior, which do you think is more beneficial to society? Now, on the one hand, nobody's stopping you from your sexual lifestyle, gay, straight, bi, swinger, whatever. Nobody's going to stop you. But the rest of us aren't going to spend the rest of our lives being burdened by a tax in your name when you could have easily controlled your behavior. If the choice is between you being more of a personnel manager to your own behavior or me paying a tax because of your behavior, which do you think I'm going to support? That's the thing. It's somehow cruel. Activists for sexual lifestyles will say to you, well, we have the right to behave like this. I agree. You have the right to behave like this. What you don't have the right to do is make me poor in the process. You have no right to take from me to offset your behavior. Your freedom to be you includes my freedom to be free from you. Your right to association is my right to disassociation. You have no right to make the claim on another human being to offset your chosen behavior. Isn't that amazing? That we have people in this country who arrogantly believe that their lifestyle choices are not up for consideration. How dare you even speak of my lifestyle? How dare you even speak of my private behavior? But when something goes wrong, all of a sudden, your lifestyle, your behavior, your private property is now theirs for the taking because they're sick. Well, I didn't make you sick. I couldn't stop you from getting sick. I love when people say, keep your laws off my body, keep your government out of my bedroom. I agree. We'll keep the government out of your bedroom forever. Now, do you have that audio? We just played you two clips of audio of Obama talking about building a one-path system. He stopped short of saying single payer. Now, do you have that original clip from, I don't know how old this is. What's the date on this? This is a pretty old clip, 2008 or 2009? 2010? Was it uploaded in 2010 or just play it? It's Obama taking a question about single payer. And he says, if we were starting from scratch, play that clip of audio.
After meeting with you, John Boehner came out and told us the House can't pass the health care bill it once passed. The Senate can't pass the health care bill it once passed. Why would we have a conversation about legislation that can't pass? As a part of that, he said, you and your White House and congressional Democrats should start over entirely from scratch on health care reform. How do you respond? Are you willing to do that?
Well, here's how I responded to John in the meeting, and I've said this publicly before. There are some core goals that have to be met. We've got to control costs, both for families and businesses, but also for our government. Everybody out there who talks about deficits has to acknowledge that the single biggest driver of our deficits is healthcare spending. We cannot deal with our deficits and debt long term unless we get a handle on that. So that has to be part of a package. Number two, we've got to deal with insurance abuses that affect millions of Americans who got health insurance. And number three, we've got to make health insurance more available to folks in the individual market, as I just mentioned in California, who are suddenly seeing their premiums go up 39%. That applies to the majority of small businesses as well as sole proprietors. They are struggling. So I've got these goals. Now, we have a package as we work through the differences between the House and the Senate, and we'll put it up on a website for all to see over a long period of time.
Yeah, stop it right there, because you know that didn't happen. And as far as premiums going up, what does that have? We never addressed the fact that when the states, and this is one of those places where the federal government should be saying, hey, you're going to let anyone sell. See, that's interstate commerce. If the state of California is limiting who can sell policies in California, it's no wonder why, when you have a captive market, you are raising the rates. The more insurance companies selling, in other words, the more supply there is to meet demand, the lower the price. Now, listen to this. The Cube Cut 1. This is Dr. Donald Berwick, Obama's choice to run Medicare and Medicaid.
You could have obscured, you could have obliterated accountability or left it to the invisible hand of the market instead of holding your politicians ultimately accountable for getting the NHS sorted. You could have let an unaccountable system play out in the darkness of private enterprise instead of accepting that a politically accountable system must act in the harsh and admittedly sometimes very unfair daylight of the press, public debate, and political campaigning. You could have had a monstrous insurance industry of claims and rules and paper pushing instead of using your tax base to provide a single route of finance. You could have protected the wealthy and the well instead of recognizing that sick people tend to be poorer and that poor people tend to be sicker, and that any health care funding plan that is just, equitable, civilized, and humane must redistribute wealth from the richer among us to the poorer and the less fortunate. Excellent health care is by definition redistributional. Britain, you chose well.
It must. I mean, he doesn't just say it once. He emphasizes it. You must redistribute wealth. You must have a single avenue of payment. Cue up Cut 2 again. Play Cut 2. This is Obama at the Facebook forum.
what we did in the Affordable Care Act, building on what we did with the Recovery Act, is try to provide incentives to providers to start getting integrated, automated systems. And it's tough because the individual doctor may say to him or herself, I don't want to put the initial capital outlay that's expensive, even though it may make my system more efficient later on. So providing some incentives, some help for the front-end investments for a community hospital or for individual providers so that we can slowly get this system more effective, that's priority number one. We know it can be done, by the way. Surprisingly enough, the healthcare system that does the best job on this of anybody is actually the Veterans Administration, the VA healthcare system, because it's a fully integrated system. Everybody's working for the VA, all the doctors, all the hospitals, all the providers. So they've been able to achieve huge cost savings just because everybody's on a single system.
Now, there he is talking to a bunch of 20-something nerds who probably have no idea what the VA does. No idea. Find me somebody who's in the VA system who thinks it's that streamlined and efficient. But everybody's supposed to be working for one system. The system is supposed to take over. One system, one single avenue of payment, one single way of doing things, one shining path, one great leap forward. Except not for everybody. You see, when Ted Kennedy was sick, he was never forced into something like that. It's amazing. Socialism is for the people, not the socialist. The people who are building this machine will never, never be consumed by it. They will never submit themselves, nor their families, nor anyone else who's politically connected to this system. In other words, I know somebody who knows somebody. I know the guy behind the guy. I know where to go to get around the system, so I don't have to be stuck with this pile of crap like you people. Now give me cut 3. Cue up cut 3. Play it.
We know that hospitals can drastically reduce those reinfection rates just by simple protocols of how employees are washing their hands and how they're moving from room to room and so forth. There are hospitals who've done it. If we can say to a hospital, you'll get a bonus for that. Medicare will reimburse you for instituting these simple procedures. That saves the whole system money. And that's what we've tried to do in the Affordable Care Act, is to start institutionalizing these new systems. But it takes time because we've got a private sector system. It's not like the VA. It's a bunch of individual doctors, individual hospitals, spread out all across the country with private insurers. So it's not something that we can do overnight. Our hope is that over the next 5 years, we're able to see significant savings through these mechanisms.
So basically what's going to happen here, it's going to be like the public school system. It's going to be like the highway system. We are going to increase the federal tax burden on the states, leaving state residents with less money, and the state government's no choice. In order to get that money back, will have to submit to the will of the federal government. And the federal government is going to tell you how you're going to wash your hands, walk from room to room, who you're going to treat, where, when, how, and how much you're going to get paid to do it. Now, thankfully, we have a governor in Idaho who is issued a state order to nullify Obamacare. Governor Otter of Idaho has issued a state order that does not recognize Obamacare for that reason. Because what's going to happen is the federal tax burden to residents of Idaho is going to go up. And Idaho is going to have to recoup that money by submitting to the will of the federal government. Because bureaucrats in Washington know how Idahoans should be running their hospital system. Is that how you say it? Idahoans? Idahoites? Idahoans. Bureaucrats in Washington know how a community health center in New York City should be run, just as they know how a rural clinic in Idaho should be run. One size fits all. One shining path. One great leap forward. Skynet is becoming self-aware. 1-866-95-PATRIOT. And you heard Dr. Donald Berwick Healthcare, by its very nature, must redistribute wealth. Am I going to be a racist if I call this socialism? Actually, this would be considered national socialism.